Sir, as we can see that the health implications of air pollution are extensive, that can lead to several chronic illnesses as well as that includes your cardiovascular. Now, the political leader has also tweeted that Delhi is injurious to health. How do you see this, sir?
It is absolutely a health-wise a major hazard because we see all the effects of it, which are many folds in the sense of people who are getting colds, coughs, people who have pre-existing lung problems, they are getting asthma, severe spasm, being hospitalized. Even lots of people have had to be hospitalized because of this. The outpatient departments are full of patients with chest problems. So this is a disaster in a way for humanity. Okay. Now the frustrating part is that it will happen every year and nobody cares to do anything about it. And why is everybody so helpless? I don't know. And I think that the blame goes on everybody, including the public, all of us, because we only wait till when we start choking that we make a noise. Otherwise, the media also goes to sleep. We also go to sleep. That's not a very good thing. The doctors have been agitating, but it's not been too effective. So there is an issue here that public health is at a very high risk right now. So that I spoke to you about people who are getting cough, colds, chest problems, breathing problems, and pre-existing. Then you go further, it is not only affecting the lungs right now because these particulates go everywhere they get absorbed in the blood, they go to your brain, they go to your kidneys, they go to your liver. So the chronic effects of it are making the public sicker than they would be if they were living in a cleaner air. Okay. So the other point is that we are doing a very big disservice to children. Because not only is it the particulate matter which we talk about, it is the noxious gases that are also accumulating. Like when the weather gets colder, the air gets frozen, and you have heard this expression before about the being like in a gas chamber. And what happens to children is that their neurological development gets affected. So, like I said, there's an increased symptoms of lung problems, of asthma, of strokes, of high blood pressure, heart disease. So, and people who are on a borderline for kidney and liver failure, they get precipitated. So, overall, I mean, you can't say enough about the fact that the pollution has to be stopped. Whatever measures we have to do, whatever sacrifices we have to make, we have to stop it. It has become a actual, I mean, it's a humanitarian disaster. So, yeah, if you can hear frustration in my voice, because we have been at it for the last 20 years. We've been talking about it. We even went and prevented trucks from coming into the city at this time. So there are many things. But right now, we need to take some very urgent measures. And this blame game should stop. And we should all work together, no matter what our political leaning is, whatever our profession is. Everybody is getting affected. And it does not spare anybody.
Yeah. Sir, as government tried to find out some kind of solution that was your cloud seeding that couldn't succeed. Do you think these are the only solution? Can't we have some other option to protect people?
No. The basic thing is, one, cloud seeding will only succeed when the humidity in the environment is above 50. It should be 60 and above. Okay. And cloud seeding doesn't work below that. The second thing is that what is it? If we can go and say that we can reach the moon, that we cannot stop the pollutants. Why can't we stop the burning of stubble? Why can't we enforce when the pollution level is at 380 plus, you can see I'm also suffering from that like a cold and cough. We are making the whole population sick. So you're saying that we are helpless. We can go to war. We can go inside Pakistan and bomb the place, but we can't control our. So that's a very, very disturbing statement that we can't do anything about pollution. Then you blame somebody else. That's not the issue. It is affecting all of us. So why blame anybody? Why not we collectively make a actual difference? So,
Sir, at this position, what do you think? What should be done? You must have seen cardiac patient must have increased during
yes,
these
of
days.
course, high blood pressure, heart attacks, asthma, like I said, kidney problems increasing. Everything is increasing. And I'm talking from a hospital point of view that we have many more patients, but we are feeling very distressed about the fact that why people are getting sick.
Sir, in Hindi, I would like to know a brief interview on same. सर हर साल हम लोग बात करते हैं पोल्यूशन की. ये जो एयर है इसमें सांस लेना बेहद मुश्किल हो गया है. बात करें बुजुर्गों की, बात करें स्कूल गोइंग बच्चों की जो सुबह सुबह निकलते हैं जिस वक्त पोल्यूशन जो है पीक पर होता है. ऐसे सिचुएशन में सर क्या किया जाए और आपके अकॉर्डिंग क्या प्रिवेंटिव मेजर्स हो सकते हैं?
देखो, ये मैं आपको बताऊं, बीजिंग was the most polluted city in the world, and they have been able to solve their problems. There is not a rocket science. You have to stop all the things that are contributing to this pollution. Whether it is, we have to do construction, whether it is vehicular pollution, whether it is stubble burning. Construction industry also contributes a lot to the particulate matter. So we should enforce it that there must be the spray machine so that everything is wet and no dust flies. So there are so many measures that we can do. But for us to measure, if this goes up to 380, 400, it is something that we must understand. People, especially older people, are getting into trouble more and more. And poor people, I feel even worse because they cannot afford air purifiers. They don't even have homes that can be sealed. So it is a national emergency as far as I am concerned. तो ये होना चाहिए आज के दिन हम सबको इकट्ठे होके. और आप बोल रहे हैं कि अभी जब ऐसा होता है तभी सब बोलना शुरू करते हैं. मीडिया भी नहीं करता, पब्लिक भी नहीं करती. जब तक पब्लिक आउटरीच नहीं होगा इस बात के ऊपर कि हमारे बच्चों के ऊपर क्या इफेक्ट पड़ रहा है, हमारे बुजुर्गों के ऊपर क्या इफेक्ट पड़ रहा है, और हमें पता ही नहीं कि हमारा कितना हेल्थ खराब हो रही है. हर एक की इन्फ्लेमेशन बढ़ गई है, हर एक की बॉडी में इन्फ्लेमेशन बढ़ी है. तो अभी इसको बड़ी सीरियसली लेना है. It is a health emergency and we should pay full attention to it and stay. अभी आप as a individually क्या कर सकते हो, जब तक इसका आप solution नहीं निकालती गवर्नमेंट, तब तक ये है कि इसका आप अपने, जब दिन में सूरज पूरा चमकता है तब थोड़ा सा पोल्यूशन कम होता है क्योंकि एयर जो है वो गर्म होकर राइज करती है. लेट इवनिंग आफ्टर सनसेट एंड बिफोर सनराइज जो है वो सबसे ज्यादा पोल्यूटेड टाइम होता है. तो इसलिए क्योंकि the air is cold and it sits on the surface of the earth, so it's like I said, it becomes like a gas chamber. तो इसीलिए जो किसी को जरूर जाना है बाहर तो आप मास्क पहन के जाएं. अगर जो आपको ऑलरेडी लंग प्रॉब्लम है तो आप देखेंगे और कंट्रीज में भी लोग मास्क पहन के घूमते हैं इससे ऐसे टाइम पे. हमें भी ऐसा ही करना चाहिए क्योंकि हमने सीख लिया था कोविड के टाइम के मास्क के साथ क्या प्रोटेक्शन मिलती है. ये पर्टिकुलर मैटर को तो रोक देगा मास्क, बट जो नॉक्शियस गैसेस हैं जैसे SO2 एंड नाइट्रिक ऑक्साइड, ये सब जो चीजें हैं ये बहुत ही हानिकारक है हमें, क्योंकि इसका जो बायोकेमिकल रिएक्शन होता है बॉडी में, दैट इज वेरी डिस्ट्रक्टिव। सो ये, और खास करके बच्चों के लिए हु आर ग्रोइंग अप, फॉर देम इट इज इवन मोर detrimental.
Thank you so much, sir, for joining us and sharing such a important information. Let's hope कि pollution, हर बार हम लोग बात करते हैं, let's hope कि इस बार थोड़ा कुछ ना कुछ सरकार कदम उठाए, कुछ ना कुछ किया जाए।
यही होप है, क्योंकि ये इंडिविजुअली भी हमें डिमांड तो जरूर करना चाहिए, और हमारे बस में नहीं है, इसीलिए गवर्नमेंट को रिएक्ट करना पड़ेगा, और अब हमारी पब्लिक को प्रोटेक्ट करना पड़ेगा, यही करना है। और आई एम श्योर गवर्नमेंट सोचती भी है कि कैसे किया जाए, पर कंपल्शंस कोई ऐसी हैं कि नहीं होता। और ये भी मेरा विचार है कि ईयर लॉन्ग जो कैंपेन होना चाहिए, ये नहीं कि जब अब हम चोक करने लगे तभी कैंपेन होगा। ठीक है ना? ओके, थैंक यू।
थैंक यू सो